Welcome to an introduction to NUCCA, which stands for the National Upper Cervical Chiropractic Association.
In chiropractic school, you're taught various techniques. Students, I believe, are dying for something like this.
So in chiropractic school, we learn a lot about objective findings. That's why we do a lot of surveys in clinic. We want to see objective change. And NUCCA is one of those few that actually their entire protocol is based on objective change.
What NUCCA is, it's a precise image-guided technique. Right? And so we take the x-rays before, we take the x-rays after, and it's a corrective process, whereas there's a lot of different forms of chiropractic and all of them are helpful in different ways. But NUCCA is different, right? And NUCCA actually is correcting at the brain stem. It's changing the neurology of the patient for the long term. And I think that's what makes the biggest difference for patients.
If someone's looking for a quick, easy fix, that's not what we're here for. And that's not really what our patients or potential patients are looking for.
What we want to do is return the head and the neck back towards normal, back to vertical. As the head and the neck come back to normal, it's in a more stable state. As it's in a stable condition, it holds. You don't have to continually get adjusted. As the head and neck come back to normal, the pelvis being the foundation of the spine, finds its way back underneath the head. So it's a full spine technique. So it's not an expansion of a typical practice, it is a practice in and of itself.
NUCCA is a very small percentage of chiropractic. It's a very specialized technique. It's just like any other part of medicine or dentistry. There's going to be an orthodontist, there's going to be general dentistry. So we're more the orthodontist part of chiropractic. It's a much smaller group. It's a very sophisticated procedure. There's a lot to learn. That's why we do 2 of these 4-day classes every year. You know, twice a year we're doing these, and in addition to that we do some other workshops around the country. So there's a lot to learn.
Yeah, I tell people all the time, I do one thing in the office, I adjust this, and then my goal as a practitioner is to know who's really good at other things so I can refer. And I can't tell you how many people love that philosophy. They don't want to go, they think they want to go one place that does it all, but they really want an expert in the field. And if people want to be an expert in the field, NUCCA is the organization that teaches us how to do that in chiropractic.
And in school, I did like every technique possible. I mean, like all the electives, I did flexion, distraction, compression, soft tissue, trigger point, activator, like upper cervical. And of all of them, it was NUCCA, like upper cervical, and then filtering through all of those techniques, NUCCA, that I saw people truly having transformations. And then I tried it myself, and I had a transformation. Yeah. And so it just was like, okay, this is what humanity needs. They need people who get it and who are dedicated to it. So now I've shifted, like I don't want to chase down rabbit holes, I want to correct this as best that I can.
NUCCA actually saved my life, so that's how I got into it. I was first a patient under NUCCA, and it helped me so much with my migraines, the numbness of my hands, my back pain, the vomiting that I had every day for 3 years. So NUCCA saved my life, and that's why I actually became a NUCCA chiropractor, and I love NUCCA. I'm a huge advocate for NUCCA.
One of the things I love about NUCCA that's different from my actual experience with what I got, once I started learning about it, you realize how specific it is, how objective it is, how much research there is behind it, and I think that's really, really important. That's something I resonate with and part of why I gravitated towards this technique.
One of the things that I love about NUCCA in general is that it's a system. We have what we do, everything is a pre and a post check, so it gives me so much certainty as a chiropractor to deliver the best possible care for my patients and get the best possible outcomes.
NUCCA does a great job at measuring when there's a misalignment and then giving you an idea of how to adjust someone, when to adjust someone, and then tells you if you're doing the job right.
NUCCA tracks a high caliber student, an analytical personality,
as chiropractors in a medical model world, that's a lot of what happens, is that we're told over and over again, objective change, objective change, objective change. But this is one of those real forms of chiropractic where we combine objective science with the philosophy of what we're doing, and then the art of adjusting is how you get the objective change. So that's why it's really a true blend of what I think it's a true blend of what chiropractic actually is.
I feel like there's a difference between moving a bone and adjusting a bone. And with the NUCCA procedure, you're always striving to adjust the bone correctly every time and help the patient hold their adjustments longer.
So it's a big decision because it's a completely different model than a lot of the techniques within chiropractic. And I mean that in a respectful way. There's just very different, it's not like one's necessarily better or worse per se. Of course, I'm terribly biased about this, but you just want to ask yourself what kind of a practice you want. What kind of care do you want to give your patients? Do you want to be pain management, where you're chasing symptoms around the body, and that's how you're effective, you're good at taking pain away? Or do you want to take care of the whole body, clear this major point of interference, and let the body heal on its own?
I help out in X-ray, and we've got plain film, we've got digital, now we've got CBCT scanning. It's exciting times. We all benefit from cloud-based storage systems, lower radiation doses, better image quality, faster analysis, easier to go through certification.
And NUCCA also has a really awesome mentorship program that we call, it's basically how you get board certified in this procedure.
Dr. Gregory developed this certification program, and there's a Dr. Marshall Dickholtz Jr. who's taken on the mantle of really expanding this certification program. And there's different levels. There's actually 4 different levels of proficiency, and each one builds on the other. So as you advance through the certification program, you eventually are able to be able to reduce the subluxation in a very high level and very consistently. And then there's so much to be learned on how to do that, from taking x-rays to the analysis of the x-rays to the adjustment to the understanding of the biomechanics of the upper cervical spine. So it's an art, it's a science, and it's a mentoring program basically. You've got a coach that works you through all these different steps, and each of these levels that I was speaking about gives you another experience of what you can be doing in the work.
And it's all volunteer, but the doctors like myself that have been around for a long time and been doing this, and we teach the procedure, we also offer mentoring just voluntarily for people that want to become board certified in the NUCCA procedure.
Sad that people in chiropractic school don't know about this amazing this technique that changed people's lives, and honestly you can make a really good living for yourself too, which they don't talk about that either, but like that's an important thing too. But really, you can have a really strong business with just clearing what needs to be cleared and letting the body just heal and restore. It's beautiful.
In the first conference, I thought, I need to understand it all now. And now I realize it's a process. You're only ready for the information when it comes. So you need to continue to bathe yourself in it. Inside and outside of the actual lectures, you get nuggets and gold stuff, and it's things that you're ready for in the moment. So you have to continually come back and just bathe yourself in it, and then you'll be able to soak in what you need to at the time that you're available. So it's everything. And the camaraderie and seeing same people with the same heart and passion to do that and like truly help humanity, it's like, it's a very profound and fulfilling spiritually to be with all these people who have the same mission. So I love it, yeah.
I think NUCCA is definitely becoming more popular. I think that people get it, right? When you hear how it works and why it works, it just makes sense to people, where you say, if the head and neck are not in alignment, if there's been an accident or an injury that causes a shift out of place, it will cause compression on the brainstem, and that will cause changes to the muscles, to the nerves, to the blood flow, to the cerebrospinal fluid flow.
The organization has worked very hard, I think, over the last 15 years to really put on a great product for doctors in the education at each conference.
Yes.
They've just gotten so much better.
I think the best thing about the NUCCA conferences and the NUCCA community is the people, right? And we are a group of people that are committed to excellence, that are committed to doing the best for our patients, the best for our communities, and that means very specific work, very quality work, because we know that when we are that specific, when we can take pre and post imaging and let that guide our clinical decision making, that the patients get the best results. And so when we are in an environment that teaches that, that supports that, and shows us how to best correct our patients, people benefit from that, and it shows.
To know that, yes, I'm trying and doing my best, but I have foundation, I have research to back up on, I have protocol, I can call people, I can reach out to different mentors and different styles, and it's just like, it's everything, and it equips you to serve your purpose.
But I feel like I could reach out to any NUCCA doctors, like go to the conferences, and even if you don't know everybody, you recognize their face. And you could reach out to anybody, and they would be open arms to help you with anything, practice advice, or just give you that encouragement that the struggle you go through with taking care of patients, they share. And being around other like-minded doctors that hold themselves to a high standard feels really good. So, yeah, I wouldn't want to be out in practice on my own without this community.
Because it's a game changer for so many people's health and so many people's lives. And it's a great way to serve people and earn a wonderful living, and everybody wins. There's no losers in this equation.
NUCCA is a phenomenal organization. So from my very first conference, people talked about NUCCA being a family, and it's true. These conferences end up being like visiting friends and family, and that's why I brought her this time, because this is my second family, and we all support each other well. There's so many opportunities for mentorship, whether it's through the official board certification program, whether it's through side conversations. There's just a lot that happens within NUCCA as a family, as friendships, but also as coaching.
It's the most gratifying career you can imagine. It seriously is. I'm past retirement age, but I have no desire to retire. I take all the free time I need, I do what I want, and I get to practice, I teach, I do consulting work on X-ray. It's like the golden years. I can't complain.
There is just such extraordinary men and women a part of this organization that are so dedicated to this work. All of our instructors are volunteers, and we put in a ton of work, and we do it really because we love this technique, and we want more people to know how to do it well.